Hi, I'm Dr. G. N. Mahapatra, Senior Consultant and Chief Department of Nuclear Medicine, PET-CT and Cardiac Imaging from Seven Hills Hospital, as well as I'm the Director, Department of Cardiac Imaging at Aurobindo Institute of Medical Sciences, Indore. Look, atherosclerotic heart disease is very common, and one of the possible causes of atherosclerosis is high lipids level or dyslipidemia or comorbidities like diabetes and hypertension. So I would like to share what should be the possible approach, how you'll go for it, detect it, treat it, and then you will be free of disease, or not exactly from disease, you will have a control on your disease process. So first of all, when a patient comes to us with this type of hyperlipidemia suspicion or anything, or just a preventive health checkup, so what are the possible approaches? So first, he or she should go for a calcium score. Calcium score is a method whereby CT scan we can detect the calcium burden in a particular coronary arteries. So if we'll do a calcium score, it takes about 1 or 2 or 3 minutes time and doesn't involve any radiation. 3 millisievert is the radiations. So you can see the calcium score. So different calcium score values have got different disease process. So suppose if the calcium score is 0, there is no need of any treatment, only lifestyle modifications will do. If the calcium 0 to 10, 10 to 99, then 100 to 300 and 300 to 400. Suppose if the calcium score is definitely 10 to 100 or 10 to 100, then definitely one should go for further testing. So further testing means either one can go for a CT scan, or you can go for a stress myocardial perfusion scan to detect myocardial ischemia as well as the atheromatous plaque by CT scan, CT coronary angiography, so that one can know and one can start aggressive lipid treatment to stabilize the plaque. You know the plaque, there are two types of plaque. One is non-stable plaque, another is stable plaque. So unstable plaque is that is attached to one of the coronary arteries, and that gets dislodged, and then that goes and blocks a major coronary artery and produces a massive myocardial infarction. So these two types of plaques, atheromatous and non-atheromatous. Atheromatous plaque can be diagnosed by either CT or any other modalities, but unstable atheromatous plaque is detected by CT scan. For example, that napkin ring sign. There are different types of positive findings so that we can detect. But CT scan does not have any sensitivity to find out microcalcification inside the plaque. So microcalcification is one of the hallmark of instability of the plaque. So PET-CT, positron emission tomography, using F18 sodium chloride radioisotope, that will go and accumulate in that plaque, and it gives us a hot plaque. That's why increased uptake plaque. So that we can tell to the treating physicians or the cardiologists, either you go for severe aggressive medical therapy, or it is a very unstable, then you can go for a PTCA or a bypass surgery. So these are called the plaques. But even the coronary calcium, if it goes beyond 300, 400, 500, 600, then we do a stress myocardial perfusion scan to know about exercise-induced ischemia. So we have beautiful cases in our both departments where I'm working, that positive calcium scores more than 600, more than 900, and a exercise-induced ischemia, so that we can hand over the patient to the angioplaster to go for a revascularization operation. Again, we have got another set of cases where the coronary calcium is not significant, like 11, 12, or 13, but after that we should do a CT angiography and find out a lesion in either in OM1 or left circumflex, right coronary, or LAD. Then we used to find out we used to do a stress MPI perfusion scan to know whether there is exercise-induced ischemia. And we have patients, sort of cases, negative coronary calcium scoring and positive CT angiography and positive MPI. But these things also we should keep in mind when there is a the nature of the plaque. If it is not calcific, it is non-calcific plaque, like fibrotic plaque, like lipid-rich plaque. So these are the cases we can pick up and we can give a correct diagnosis. These findings are there. Always do this calcium scoring as a first line of treatment. See your coronary arteries, see the atherosclerosis detection and the future developments, and take the consultation from the treating physician what to do next. With this, I share and subscribe to LAI TV for more information about this. Thank you.